Three compounds, same receptor, same brain network. One of them makes people want to die. The other two stop them from wanting to. This is not a fringe finding. This is peer-reviewed data, replicated across institutions, sitting in the same databases. And no one can explain why. The receptor is called 5-HT2A. It lives on neurons throughout your cortex. When psilocybin binds to it, suicidal ideation drops, sometimes within hours. When MDMA floods the system, veterans with treatment-resistant trauma report, for the first time in years, that they want to be alive. But when LSD binds to that same receptor, the odds of suicidality go up. Same family of molecules, same class of experience, same therapeutic framing. Opposite outcomes on whether a person wants to continue existing. Something is wrong with this picture, and the wrongness is not going away. Here is what makes this stranger. The science is not failing. It is succeeding in 10 different directions at once. Late-stage clinical trials on psilocybin are solving problems that have resisted treatment for decades. Veterans with PTSD so severe no drug touched it are walking out of MDMA sessions with their symptoms cut in half. Researchers measuring neural plasticity after a single dose are watching the brain rewire in real time. 7 out of 10 findings across completely unrelated fields, addiction, depression, anxiety, trauma, are pointing at the same mechanism. A temporary relaxation of the brain's rigid constraints, a window where the mind becomes changeable again. The convergence is not subtle, it is 71%. 10 domains, all arriving at the same door. But then there is this. The FDA rejected MDMA-assisted therapy, not because it did not work, the trials showed it worked, but because, they said, the evidence was insufficient. At the same time, esketamine, a compound with weaker effect sizes and documented safety concerns, sits on pharmacy shelves with full approval. Cost-effectiveness analyses contradict each other on the same treatment in the same patient population. One says combination therapy is the answer. Another says it is not worth the cost. The evidence is not uncertain. The evidence is at war with itself. And at the center of that war, the question of whether these compounds heal minds or whether some of them break them. The leading model says this: psychedelics work by temporarily dissolving the rigid patterns that keep the brain stuck. Depression is a groove worn too deep. Trauma is a loop that cannot stop replaying. These molecules lift the needle. But here is what that model cannot explain. Why would one molecule, LSD, lift the needle and drop it somewhere worse? The honest answer is, we do not know. The model is robust. It holds across 76% of the data, but it fragments under pressure. The direction of causation is unresolved. The same mechanism that looks like healing in one context looks like harm in another. 8 chronic contradictions sit in the research, persisting at 92% confidence. They are not anomalies waiting to be cleaned up. They are fault lines. What this means is uncomfortable. We are closer than ever to treatments that could end suffering that has resisted everything else. Veterans who have tried 12 medications are getting their lives back. People who planned to die are, instead, planning futures. And at the same time, we do not fully understand why. The map is 71% complete. That remaining 29% contains the difference between a cure and a catastrophe. The science is not lying. But it is not telling the whole truth either. 3 compounds, same receptor, same brain network. One of them makes people want to die. The other two stop them from wanting to, and until we know why, we are working in the dark.